There is a saying in medical fraternity, लड़कियों का heart attack नहीं होते. But it is not true. They do get heart attacks. They should go for at least for walking for 30-40 minutes in a day. They should have a time period when they can meditate for themselves. They can engage themselves for yoga and other things which can control their weight. We inherit.
Is it?
Yes. Heart disease is the major thing of the inherited. And it is not only your just father, your mother. It travels through your genes of your entire generation tree.
बहुत young लोगों को भी blockage का जो issue है that is becoming quite often nowadays because of the lifestyle changes of course. Blockage के क्या symptoms हो सकते हैं?
If you talk about the symptoms, there are generally few symptoms which should be noticed at the earliest and start treating. The one of the symptom is if a female while doing his household work feels fainting, she is not able to breathe properly, she should consider about checking the status of her heart.
Hello everyone and welcome to the Voice of Woman podcast. I am your host Diya Singh and today we are joined by Dr. Kapil Khanna, a renowned cardiologist and physician, to discuss women's heart health. Now we'll cover essential topics like the impact of pregnancy on heart health, lifestyle changes to reduce heart disease risk, and the role of stress and how menopause affects the heart. Additionally, Dr. Khanna will also share insights on unique heart disease symptoms in women, heart healthy habits, and what to do during heart emergencies. So, before we start the video, don't forget to subscribe to our YouTube channel and also press that notification bell icon so that every time we upload a new video, you get notified about the same. And welcome, sir. We are really excited for this conversation.
Hello, everyone.
Right. So, with this, everybody, let's get started with the video. So starting with the very basic question for every woman out there, which is how women can keep their heart healthy and happy at the same time. क्योंकि हम women अपना ध्यान बिल्कुल भी नहीं रखते.
Absolutely said rightly. We say doctors are as a life savior, but I say woman is a life manager and taking care of entire family, and without that we can't do. But on the contrary of this, females are very neglected about their self-health.
Right.
So I would like to focus on their heart ailments, which they generally ignore all due the course of their lifespan. पहली चीज, there is a saying in medical fraternity, लड़कियों का heart attack नहीं होते. But it is not true. They do get heart attacks and they do get heart diseases. So we have to be cautious about their health and their well-being.
Right.
So if we tell you about the taking care of the good heart, in day-to-day work, females generally forget about their physical activity. They think we are doing home activities, we are doing household work, we are doing our job work. So that includes their activity, but it is not. I would say they should take out time for their well-being. They should go for at least for walking for 30-40 minutes in a day. They should have a time period when they can meditate for themselves. They can engage themselves for yoga and other things which can control their weight. You have seen around you that females generally get overweight over the period,
right,
especially after pregnancy.
True.
So, and whatever it is meant that during pregnancy, females should gain weight. But it is also to be taken care that after the pregnancy, they should reduce and bring back to the normal of their BMI, which in terms of taking care of their baby and family, they forget about that.
Impossible.
They forget about that and they keep on caring about their family and kids and forget about their good health. So for this, I would say that they definitely take out time for physical activities, especially for themselves, in which includes the walking in a day at least 30-40 minutes, some of the yoga or meditation, so that can keep their heart and mind stable and healthy.
Right. Sir, what factors women can consider as alarming situation wherein what symptoms you would like to enhance or highlight here, which women should be concerned about, talking about specifically the heart health?
If you talk about the symptoms, there are generally few symptoms which should be noticed at the earliest and start treated. The one of the symptom is dyspnea, which we say सांस फूलना. Like if you are walking some steps and you have some dyspnea, then you should consider that there is something is wrong. It could be because of anemia, it could be because of some other multinutrient deficiency, but one is the factor is heart disease. So if a person, if a female, while doing his household work, feels she's fainting, she is not able to breathe properly, she should consider about the checking the status of her heart. In that context, also not only just having shortness of breath or breathing difficulty, she should also look for unwanted sweating, unwanted chest discomfort. These are the few things which she should notice and should address to it immediately. One more thing what we have observed in females, that they have a feeling of palpitations. Like you feel like having beating heart, faster beating of the heart, or they feel like sinking of heart. These things should be addressed to the doctor, because sometimes they are a false alarm, but it may be the reason for the worry.
Right. Talking about the next question, which is, I have heard several news nowadays, which is of bypass surgeries. And bypass surgeries, patients usually opt for जब blood blockage का situation होता है, right? अब this is something which I have heard and which is very, I feel alarming, कि बहुत young लोगों को भी blockage का जो issue है, that is becoming quite often nowadays because of the lifestyle changes, of course. So इसके ब्लॉकेज के क्या सिम्टम्स हो सकते हैं सर, एंड हाउ टू इंश्योर कि आप रेगुलर डॉक्टर के पास जाकर के अपना इको वगैरह करा रहे हो हार्ट का, ताकि आपको पता चले कि हाउ इज योर हार्ट हेल्थ, व्हाट्स द स्टेटस.
Absolutely said rightly. But in this context, when you said that we are facing nowadays younger people coming across with the cardiac diseases, but in that context, females are on the lesser part. We have observed that males are getting this type of news in the newspapers. You must be reading in the newspaper that person of young 40 years had sudden cardiac arrest and he died while doing his gym, and he's a gymmer and all those things. But it is not that they are getting now. It is not the people, those who are just coming in the newspaper. It is definitely there is a rise in number of patients with the younger age getting these types of disease, and it is not less number for females, but definitely it is lesser than the males. Why they are getting these disease? I would say that we have to understand the pathology behind the disease, but they are having it because of the change post-COVID period. There is a myth that those who had 2 or 3 vaccines of COVID, they are getting more of that. It is not like, it is not true. It is something we all have gone through, but during COVID, we all have come across so many things which has changed our metabolism.
Right.
Moreover, if you check across those who have come across in the past days in the news and all, there must be one tag common into all is gymmer.
Right.
So gymming is a good thing for heart, but proper gymming is the requirement for the day. You cannot just do any type of exercise for any person. You should be trained in that way that your heart should take the load of the exercise you are doing. Because doing excess exercise is also not good for your heart. Because
Absolutely.
if you are starting your exercises at the age of 36, 37, and by the age you are 40, definitely over the 3 period your heart doesn't become that good that it can bear any type of stress. So if a person who is doing exercises long years, he can do at any extent of the exercise and take the stress of any kind. But in last 2 or 3 years of exercise, you cannot go for the beyond the limits. So you should understand which is the limit.
Right.
Sometimes in gyms they have competition that I am doing so much of push-ups and you are not doing that much of push-ups. So we have to understand
Not
that
everybody is
not
alike.
everybody has a like and everybody have their own stamina.
Right.
So we have to do it. Moreover, the diet what they are following, I would say, maybe gymmers will not like it, but I would say that you should have a natural protein rather than depending on those big
Synthetic
boxes and
protein.
synthetic
Right,
proteins. That
right.
is the
I am also
main.
against protein, by the way.
And similarly, that applies for females also. If they are going gym, they should focus on their toning of muscles rather than building up the muscles, because at one extent of your life, You cannot add on the muscles mass. For that, you need to add some of the other stupid things. Sometimes we say, do you eat more protein? Yes, you eat protein, and protein is good for your body at the any age of your body age. But it should be taken as a natural protein rather than taking up the synthetic protein.
Right. Okay, so let's talk about heart attack.
Yeah. Heart attack, there are few symptoms which you should know for even from the age of 19 years. What I have seen a guy of 19 years I have treated. So he was while playing cricket, he kept on playing, and he came with after when he finished his inning, he came that I am having chest pain. And when we did the ECG, we came to know that he's having heart attack.
Oh God.
Yeah, but because of his age, he extended that stent. He kept on playing while even having chest pain. So when we did his angiogram, we found his major artery was blocked. But it is quite strange to know that he, at the age of 19, because I'm talking about the youngest what I have seen in my career.
Right.
So people think that heart attack has to be done at a certain age.
Right.
But
19 साल का बच्चा.
Yeah.
And he's
So-
suffering. And sir, sorry to cut in between, पर heart attack में this is said ना कि कुछ ही seconds का time होता
no,
है
it is
जिसमें.
sudden death.
Okay.
जिसमें कुछ minutes का time होता है, that is 3 minutes is that there when we have time to revive someone. But heart attack gives the time, and younger have much more capacity to maintain it. So he must be having this thing. And when we found out the reason behind it, why he had, there is a strong family history of his heart attack in his family history. His cholesterol levels are really bad. His family's cholesterol levels are really
Heart
bad.
disease is also something which which
Yes, we
surpasses through
inherit.
the.
We inherit.
Is it?
Yes.
Oh,
Heart
God.
disease is the major thing of the inherited. And it is not only your just father, your mother. It travels through your genes of your entire generation tree.
Oh.
Like if your father is having a heart disease, you should think of your dayaji, your dadaji, and kisko hua hai.
Okay.
So if it is there, so definitely it comes out to be on a very bad impact if you have a heart disease history in your family. You should be very cautious about it, and you should take care of your heart as better as can possible.
Right. तो सर कैसे हार्ट अटैक आने के बाद वो तो बच्चे को समझ नहीं आया, but what is the normal symptom?
See, generally patient complains with the complaint of chest pain, heaviness around your chest. It can be radiating to both arms. It can be radiating to your shoulder.
हाँ, this is also I have heard कि हार्ट अटैक के टाइम पे लेफ्ट आर्म
Your shoulders, your
pain
both
रहता
arms
है.
can have pain, and it is progressively increasing. It may not be lasting, like it cannot be like this that your left arm is only paining and chest is not paining. It can be individual, it can be both together. So we have to assess whether it is a neurogenic pain or it is a cardiogenic pain. So we have to address any kind of pain which is happening on your left side. That is the focused. In a patient who is suffering from heart attack, he will have chest pain. Associated problems will be he must have sweating. He must have pains in his arms. He can have his pain in shoulders. He may have a pain in his jaw also.
Okay.
Yeah. So sometimes we have a patient comes with the toothache. We say, okay, toothache. When you have toothache, so he says when we walk. So when there is a addition of any stress and pain, then we have to correlate with the cardiac disease.
Right.
If someone is having toothache round the clock and he's just getting pain relief with the painkillers, so then it could be just a related to dental problem. But if he's saying I have toothache when I walk,
exercise करते
yes,
वक्त,
so it
right.
should be noticed at that time.
So there's one medicine which doctors usually
Sorbitrate.
Right. और उसको जीभ के नीचे रखना होता है.
बिल्कुल.
Sir, I have been a part of a critical situation wherein I saw my grandfather and he was suffering from heart attack, and we were all in a panic, and during the time of COVID we had this medicine with us. So in that panic situation we gave him twice. That medicine we gave him twice because हमें लगा था असर क्यों नहीं कर रहा, असर क्यों नहीं कर रहा है. So, but the moment we reached the doctor said that it was not cardiac arrest, it was gestational pain भी होता है ना इस chest area में. So
it was GRD, gastric pain.
Right.
It must be gastric pain.
Right.
We do not advise to take 2 tablets of Sorbitrate
Yes.
immediately. we say that you should give one tablet sublingually and wait for 5 minutes so that its action starts and give you the relief. If you do not get, you can try the second tablet of Sorbitrate after 5 minutes, not before that. Secondly, you should maintain that person who is taking Sorbitrate should sit down, because there is a fall of blood pressure after Sorbitrate.
Okay.
So if there is if you have a blood pressure machine, because nowadays people do
Everybody has it.
so
right.
you should check if someone is complaining. See the blood pressure. If it is less than 100, should not give Sorbitrate.
Okay, ये भी
Yes.
situation है.
Secondly, even if he is having heart attack and his heart pressure is less than 100, shouldn't be giving the
Sorbitrate.
Sorbitrate.
Is it Sorbitrate or
It is Sorbitrate.
Sorbitrate. Okay.
Yes. Sorbitrate tablet is 5 milligram. It is a heart-shaped tablet, and you should give it under the tongue. Okay, it dissolves, self-dissolving tablet. It is. Secondly,
How it works, sir?
It goes through the vessels and helps the arteries to dilate. So what happens when heart attack is going on? Our arteries get constricted because of that blood flow
Gets blocked.
and that causes the chest pain, and that is the symptom of heart attack. But when you take a Sorbitrate, it gives a little dilatation. So it opens the vessels and allows the flow.
Right. So, sir,
I would like to add one thing as you asking about the Sorbitrate. I would tell my viewers there are 3 drugs which they can keep in a small pouch and keep in their pockets. You must have seen the videos of Ram kit and heart saving kits and all. I would say that you should keep these 3 tablets in a small pouch and keep it in your pocket. It may be helpful for XYZ person whosoever suffered from the heart attack. If someone is in front of you complained of chest pain, having sweating, and I'm telling you, these 3 drugs are not going to harm him at all. It is going to save at least 30% mortality. It will reduce the mortality rate by 30% and salvage him in a much, much better way. So these 3 drugs are Disprin, 1 tablet, Clopidogrel, 75 mg, 4 tablet, and Atorvastatin, 80 mg, 1 tablet. These 3 drugs should be kept in a pouch and keep ready with you all the time. It may be helpful for someone in need.
So what are these drugs for? For heart attack only?
Yes, it is for heart attack only. Disprin, you must know that it is it contains aspirin, which is a blood thinner. Clopidogrel, another a clot dissolver, and atorvastatin, another a lipid stabilizer. Okay, so that helps, and this is whenever you go to the hospital, if someone is suffering from heart attack, these are the 3 drugs which any hospital, any doctor will give it.
Right.
Okay.
Right. So this medicine which we talked about, heart-shaped one, what was Sorbitrate. So, what are the chances? Is it 100%? 100% it works that giving it to any person?
It can help.
It can help. Probability वाला situation is there. Right. And so, क्या advisable है उसको उस medicine को देने के बाद कितने minutes बाद हमारे पास time होता है? We have a time span in our hand ताकि हम hospital तक भाग सके.
See, if you give 1 tablet and patient does not have any relief, you should start moving towards the hospital, and in between you can try twice in the interval of 5 minutes. Like Sorbitrate you have given, patient is not having any relief, start walking towards the hospital, because the time period is 5 minutes apart, so you can have 15 minutes to reach the hospital. And don't ever think I have to go to XYZ hospital. The nearest, go there, because you will have the things where you can get the help of a doctor.
Right. What age you would suggest or advise for women to go and get their heart
physical? See, after the age of 35, we should consider our once in a year our lipid profile along with thyroid profile, because these 2 things are all together. If someone's thyroid is deranged, there is a possibility of high cholesterol levels. So if and in females, thyroid is very much common and can cause many other diseases. So it is better to have the checkup of thyroid and your lipid profile annually, once in at least a year. If you have deranged, then you should follow the instructions of the doctor regularly.
All right, everybody, that brings us to the end of this video. हमने कोशिश की कि हम सारे important pointers cover कर ले, which is actually really very essential for you to make sure that your heart is healthy and happy at the same time. And if you really like this video and if you really like Kapil sir, sir sits in
Indirapuram, Anubhavi Clinic at Gyankhand 2, Indirapuram.
Right. And the detailed description will be there in the description of this video. So make sure you're checking that out, or location वगैरह सब will be there in the description box. And before leaving, make sure you're giving this video a big like and commenting and letting us know which was the best part for you. And also make sure you're subscribing to our YouTube channel, The Voice of Woman. Till then, make sure you're a woman, you are independent, and you're taking a good care of yourself. Okay, bye.
Thank you.